Welcome to TimeOut, an exciting new educational video series brought to you by First Case. In this series, we're bringing you easy-to-access education with no fees and no tests. Break free from boring staff meetings and dive into educational content that you can put into practice immediately. So let's get started with today's episode of TimeOut.
Welcome to today's episode of TimeOut. Today, we're going to talk about the OR environment and the great lengths that we go to prevent surgical site infections. What we're really talking about is all of those ways that we ensure that the operating room, our environment, keeps the risk of injury, infection, and contamination at a minimum for our patients, both from a clinical standpoint and from a facility standpoint as well. Clinically, we scrub our hands, we wear gowns and gloves, we follow the principles of sterile technique, and we have strict cleaning procedures that have to be followed. Cleanliness is of utmost importance for a safe environment. AORN says that every facility should have environmental sanitation processes in place that are defined by a multidisciplinary team and supported by facility policies and procedures. Every single patient is entitled to a clean environment for their surgery, whether they're the first patient of the day or they're the emergency add-on at 2 a.m. They all deserve the same clean environment. And we need to adhere to established policies for keeping our OR environment clean. But there's more to our OR environment than just keeping it clean, although that's definitely a huge part. The facilities management of the OR involves controlled access and measuring and controlling temperature, humidity, ventilation, and pressure. Even the design of the OR and the type of building materials used are specific to the unique requirements of surgery, and everything works together to ensure a clean environment that helps to prevent surgical site infections. Okay. Here's what you need to know about controlled access, temperature, humidity, ventilation, and pressure within the OR. First, controlled access. Within the perioperative suite, we have 3 different types of access. We have unrestricted, semi-restricted, and restricted. Unrestricted is just like it sounds. Street clothes are allowed. Patients come into this area from the outside. A waiting room is a good example of an unrestricted area. The semi-restricted area is limited to properly attired, authorized personnel. Proper attire includes scrubs and head covers and beard covers. In the restricted area, the same attire is required, with masks being required as well. Temperature. The temperature in the OR should be maintained between 68 degrees Fahrenheit and 75 degrees Fahrenheit. We often increase the temperature when we're operating on pediatric patients, geriatric patients, sickle cell patients, or trauma patients to prevent hypothermia. Thermostat adjustments should always take the patient into consideration. Patients that do not maintain normothermia during surgery have an increased risk of infection. Humidity. Humidity should be kept between 20% and 60%. Those of us in the OR don't control the humidity. It's controlled by the HVAC system. But we have to be aware of what the acceptable range is. You should always know what the humidity level is inside your OR. When the humidity level goes above the limit, we can get condensation inside of sterile packaging. And condensation causes contamination. Anytime humidity is out of range, it should be reported. And then you should follow your facility's policies and procedures regarding your next course of action. Ventilation. Operating rooms must have a certain number of air changes per hour for proper ventilation. Air changes and circulation provide fresh air and prevent the accumulation of aesthetic gases and microbiologic particles in the room. 15 air changes per hour are the recommended minimum for procedure rooms. General ORs and C-section suites require at least 20 air changes per hour. And finally, pressure. Operating rooms are positive pressure rooms. The pressure inside the OR is higher than the outside, allowing air to leave the room, but not allowing it to come back in. I like to think of the air being able to go down and out when I think about a positive pressure room. You don't want the air coming back into the OR from the outside area and bringing contamination back into the room with it. Dirty rooms like decontam and the soiled utility room are negative pressure rooms. They are maintained at a lower pressure than the areas around them so that air can flow in, but it doesn't flow back out. This prevents the air from pushing contaminated particles out of those rooms and into the rest of the department and exposing people to contaminants or pathogens. Also, please note that it is not recommended to convert ORs from positive pressure to negative pressure for COVID-19 patients or patients with airborne diseases like TB. Maintaining an environment within the OR that helps prevent surgical site infections and promotes patient safety is challenging. There are many variables and they can all have an effect on our surgical outcomes. Paying attention to all of the details, knowing the safe parameters, and following established guidelines and your own policies and procedures are necessary in our fight against infection. That is all the time that we have for today. I'm your host, Melanie Perry. Thanks for watching.
That's going to do it for this episode of TimeOut. As a reminder, you can help support us with a like, a share, or by subscribing to this channel. You can also subscribe to the First Case podcast on your favorite podcast application. I would appreciate a rating and a review because your feedback is important to this show. On behalf of everyone at First Case, thank you for watching this episode of TimeOut.